Dear Chair, dear audience, in the next few minutes I would like to talk about my thesis, which is the inflammatory processes of the urinary tract and its association with genitourinary cancers. So before I introduce myself, I'd like to introduce the problem we face. Rather, the problem that women face is that they have a 1.1% risk during their lifetime to develop bladder cancer, which overall has a mortality of 35 to 40% within 5 years. Not only this, but 10% of all women develop recurrent urinary tract infections, which might be associated with bladder cancer. Since there are methods to decrease, prophylactic methods to decrease the number of UTIs, it is important to determine whether they are a risk factor for bladder cancer. In our systematic review and meta-analysis, we showed that women who have had more than 10 UTIs are at 44% increased odds of developing bladder cancer. Therefore, women with recurrent UTIs should be considered for prophylactic interventions, and they may need to be monitored more closely. Further research needs to add more well-designed, perhaps prospective studies, and focus on the effectiveness of these prophylactic interventions. So, my name is Róbert Vass. I am a first-year PhD student and a resident doctor at the Department of Urology, and our vision is that we'd like to reduce the incidence of genitourinary cancers. The first step in doing so is identifying risk factors. So a year ago, we started 2 projects, and in both we wanted to explore the relationship of bacteria and the bladder mucosa. And in the first project we did this in a epidemiologic scale, and in the second we plan to do it on a metagenomic scale. So our first project, here we investigated the effect of lower UTIs on the incidence rate of bladder cancer. So as I've suggested earlier, bladder cancer is not a rare disease, and while it is true that the incidence is higher in men, women do tend to present with a more advanced disease than men. Several risk factors have been well documented and are well known for this disease, with smoking being held accountable for the highest number of preventable cases. But there is also a risk factor of infectious origin, which is well documented, which is schistosomiasis. It is an infection by a blood fluke. Not only this, but there is also some evidence that bacterial UTIs are a risk factor for bladder cancer. And this, of course, carries a huge weight, because half of all women will have at least one UTI during their life. A quarter of those women will develop recurrent UTIs, which, well, putting the whole number worldwide up to the 100 millions, and in this very room that would mean like 2 or 3 who have recurrent UTIs. And my guess is that those of you would like to know if you are at an increased risk for bladder cancer. So are we. So we asked the questions, do frequent lower UTIs increase the incidence of bladder cancer in women? We chose to investigate adult women, and we compared the rates of UTIs in women with bladder cancer to that of women without bladder cancer. So we performed a thorough systematic search, and we did cast a wide net, with the initial number of studies being over 15,000, but in the end it netted only 10 included studies, and only 4 of those were included in the quantitative analysis. So now I would like to show you the results. As I've said, we included 4 studies. All 4 are case control studies, and we divided our population sample into 3 categories: low, medium, and high exposure, based on the number of UTIs recorded during the observation period. Our outcome is bladder cancer in all cases. Yes. Heterogeneity was considerable in our study groups, mainly due to the different methodological considerations in the studies. So, in the low and moderate exposure groups, we observed no clinically relevant difference in odds for developing bladder cancer, and they weren't statistically significant either. But in the high exposure group, we observed a 44% increase in the odds to develop bladder cancer, which proved also to be statistically significant, which suggests that these women are at a higher risk for developing this disease. Well, we have a few strengths and some limitations in our study. We did adhere to a rigorous methodology, and in the end, we did include a high number of patients. But, as I've said earlier, we observed a considerable heterogeneity between the studies. We included a low number of articles, and they are all retrospective. And we also did have to use crude values in our analyses. So what can we conclude with all these limitations? Well, we can conclude that women who have more than 10 UTIs may be at 44% higher odds of developing bladder cancers. In the practice, this means that these patients should be monitored more closely, more frequent checkups, perhaps, and also to offer prophylactic treatment for recurrent UTIs in every case. And for the research part, well, we obviously need a lot more well-designed studies, and we also need information on the muscle-invasive status of the bladder cancer and the histologic subtypes, because this would greatly impact the prognosis for these affected women. Currently, we have finished the first draft of our article, and we plan to submit it in the next month. So, in the second project, as I've said, we explore a similar idea, but on a metagenomic scale. So here we would like to compare the composition of the urinary microbiome in bladder cancer patients and healthy individuals. As we know by now, urine is not sterile. It has its own microbiota, and this microbiota can be in imbalance. And in the case of several other diseases, a link has been already established between a microbiota disruption and the disease, which ranging from metabolic to cardiovascular to cancers, everything has been already studied. But since these microbiome studies are costly, no longitudinal studies are present, and causality is still a topic of debate. And since we, in the previous study, showed some evidence that UTIs increase the risk of bladder cancer, we think that that it should be evaluated not only for symptomatic patients, but whether there is a specific composition which is specific for bladder cancer. So our research question is there a difference in the composition of the urinary microbiome in bladder cancer patients and healthy individuals? So we would like to compare the microbiome composition for bladder cancer patients and non-bladder cancer patients with focus on metrics such as relative abundance and alpha diversity indices. If any significant results should be uncovered, then further research could determine causality through longitudinal studies, and in the clinical side, maybe a potential use as a biomarker could emerge. So, and we hypothesize that there is a distinct, different composition for bladder cancer patients. Currently, we still only have a preliminary search key, and in the following weeks, we will prepare our prospective registration and start with this study as well. So to summarize, these are the two studies we've been working on for the past year. And the first one we plan to submit in the next month, and the second one later the next year. And I would like to close with the words of Confucius that the man who asks a question is a fool for a minute. The man who does not ask is a fool for life. Thank you for your attention.
Robert, you just masterized the UTI for me. No problem. Just a theoretical question, and if a woman got like 10, 15 episodes of UTI and then it be cured by antibiotic regimen OM89, anything else from the EUA guideline, the risk for having a breast cancer, can we lower it, or it means a lifetime high risk? Because it's an important question.
Yeah, it's a very good question, and sadly there is absolutely no answer for it because so the data is very sparse, and the observation periods are for some reason not very well documented. So when those women had the UTIs is not very well documented, so we cannot infer if there is a lifetime risk or just risks in the following years, but it would make sense that it is not a lifetime risk, but a risk for the following few years.
Yeah, exactly. We have no answer to this question, but I'm really interested in this answer. So if you find, just text me.
Sure.
Yes or no.
If you give me a phone number, then sure.
Okay.